Many thanks for staying with us. Welcome back. You're watching us on KTN News. This is Kenya's premier, Kenya's news station where the news comes first. So KTN Prime continues. The Ministry of Health has banned the use of sanitization booths in tunnels as a preventive measure against the spread of coronavirus. The booths that have been a hit since the virus struck in March this year have been adopted by several counties and do not conform to the ministry's guidelines as there is no evidence to back their efficiency. This as the country's virus burden nears the 7,000 mark. Here's KTN's Brian Otieno with the latest.
In a notice issued by the Acting Director General of Health, Dr. Patrick Amoth, there is no evidence to show that such sanitization booths offer protection against the virus that continues to claim many lives worldwide. And now the Ministry of Health wants the use of such booths stopped with immediate effect. Meanwhile, the number of positive cases remains on the rise, with the country's tally inching closer to the 7,000 mark.
Today, we report 268 people who have tested positive over the last 24 hours after testing 2,704 samples. We have also lost 3 more patients to the disease, bringing to 152 the total number of fatalities. 9
out of the new positive cases were of foreigners, as the ministry confirmed reports that some students from South Sudan tested positive for the virus. The neighboring country is a regional hotspot, reporting more than 600 deaths from at least 9,500 infections.
Of course, there is what we call patient confidentiality. These are cases that we have reported from Mombasa, but we didn't disclose that these people actually came from Sudan, but they are captured in our line list.
Currently, anyone wishing to travel into the country requires a COVID-19 free certificate whose validity is limited to 24 hours. It is, however, unclear whether the said students were cleared for travel. The proposed reopening of the economy remains a topic on the minds of Kenyans, with the Ministry of Health assuring that it was considering all possible scenarios.
Going forward, we are having more locally generated information, which we are using to be able to model and which reflects the reality of the Kenyan situation instead of what used to happen when we used to base our modeling on data from China and other places.
The ministry further maintains the necessity of posthumously testing those who die under unclear circumstances as a safety measure for close relatives. Brian Otieno, KTN News.
At the same time,